Tonight's bedtime lesson is about broken or knocked out tooth. It's quite short. Knocking out or displacing, moving out of position a tooth is a dental emergency. If an adult tooth or permanent tooth is knocked out or displaced, try putting it back in place and go to a dentist immediately. Don't try to reinsert a baby tooth. Call a dentist or phone 111 for advice as soon as possible. If you can't put an adult tooth back into position, place it in milk and contact your usual dental practice. You may be able to see a dentist straight away, or you may be directed to an urgent care dental service. If you don't have regular dentists, you can phone 111 for advice on where to get urgent care. If the tooth is just chipped, you should make an appointment to see a dentist to fill the tooth or smooth it down. This isn't an emergency and can wait until the dental surgery is open. A knocked out tooth. If you knock out a tooth, you should find the tooth, hold it by the crown, the white bit that sticks out at the gum, lick the tooth clean if it's dry, or rinse it in water, put it back into position, adult teeth only, never try to reinsert a baby tooth, bite on a handkerchief to hold the tooth in place, or phone your dentist or phone 111 for emergency appointment if you don't have a dentist or if it's closed. Ignore that. If you have a bleaching tray or mouth guard, you can put this into your mouth to hold the tooth in place while you can wait to see a dentist. If you don't have those, you can also use a foil bandage. If you can't put the tooth back in position, put it in milk and phone your dentist. If you don't have a dentist or it's closed, phone 111 for an emergency appointment. The sooner a knocked out tooth is reimplanted, the more likely it is to end itself back into the gum. If your child knocks out a baby tooth, you shouldn't try to reimplant it because you may damage the adult tooth growing underneath. Take your child to see a dentist immediately. At the dentist. If you've put your tooth back in yourself, the dentist will check at the dentist. If you put your tooth back in yourself, the dentist will check that it's in the correct position by having a look and taking an x-ray. They'll splint it into the teeth, either side, to hold it in position for 2 weeks. Splinting is a technique that temporarily attaches the tooth to keep it in place. If you've put your tooth in milk and gone straight to the dentist will then carry out the appropriate treatment. They may need to numb the affected area and reposition the tooth. They'll check that it's in the correct position, and they might take an x-ray. They might then splint it to the teeth either side for a few weeks, but treatment options will vary depending on the damage it's done. A lost tooth. If you can't find your tooth, the space can be filled with one of the following: a denture, a removable false tooth that you have to take out and clean, a bridge where a false tooth is glued to the teeth either side using a special cement, or an implant where a titanium screw is placed in the jawbone, and after a few months a mold is taken so that a false tooth can be made. Not everyone needs to have missing teeth replaced. Some people don't mind having a gap. Speak to your dentist about your options to help you decide what you would like. A broken or chipped tooth. If you have broken your tooth, try to find a fragment, store it in milk and see a dentist as soon as possible during working hours. The dentist may be able to glue the fragment back onto the tooth. Don't worry if you can't find the fragment. Your dentist will be able to use a tooth-coloured filling material to build your tooth up. If part of the back tooth is broken, it may either need a filling or a crown, also known as a cap. If the tooth is badly broken and the nerves are exposed, it may be a little sensitive and the teeth may need root canal treatment. This involves removing the nerve and placing a root filling. Protecting your teeth during sports. If you play a sport where there's a risk of being hit in the mouth, you should wear a mouth guard to protect your teeth. If you or your child are involved in playing or supervising sports where trauma is a risk, it's important to know how to reduce the risk of mouth or dental injury, and what to do in the event of a mouth or dental injury. To have a mouth guard made, a dentist will take a mold of your teeth. The mold will be used to make the mouth guard. This type of mouth guard is known as custom made. They are comfortable, retentive, and protect your teeth. You can also purchase spoil and bite mouth guards, which are molded using hot water and one size fits all mouth guards. Although these are better than not having a mouth guard, they offer less protection than a custom made guard. The Dental Trauma UK website has more information about the management of dental trauma and mouth guards, which you can look on the web. That's all for today. See you soon. Bye.